I would also like to invite to the podium Dr. Deborah Ward, who it's been my pleasure to know for many years, and to, in addition to the faculty role I have with the School of Medicine, it's also been my pleasure to be a member of the faculty of the Betty Irene Moore School of Medicine for some time now. Dr. Ward is the Dignity Health Dean's Chair for Health Leadership and is the current interim dean for the Betty Irene Moore School of Medicine. And with that, Debbie, if you would.
Hi, everybody. We're so glad you're here. This is an active learning space. The reason these tables are set like this is that normally in this room, there is nobody up at the front. The poor teacher, I say poor teacher, but they're adjusting, circulates in the room, and each pod, these tables are called pods, has their own screen, and you there at table A, you solve the problem first. Show us if you solve the problem, and then we'll demonstrate it to the rest of the room and see how it works. So this is the way this room generally works, but in the spirit of being recorded and in having you all here today, we'll do whatever we need to do to welcome you. So we're so glad you're here. Thank you. We built this space, and we were so fortunate to be able to do this to support interprofessionalism, foster discussion of diverse perspectives, and advance innovation, and that's what we try to do here. So thank you so much, Ken, and everybody for choosing this place to come. I'm really happy. I understand from Ken, as he just told you, that this rarely happens outside of National Academy space, and we're thrilled that you would come here to UC Davis. Thank you for that. So when the wildfires hit Northern California last November, classes were canceled here. And School of Nursing students immediately stepped up to work in this disaster, this unfolding disaster. And we had volunteer students from our physician assistant program, from our nursing programs, who stepped forward and supported victims of that deadly campfire in Paradise. So they collected and delivered goods and supplies. They aided shelter clinics. They took care of people. These future health providers spent countless hours providing urgently needed care. And I happened to be able to go just last week to an event at the Chancellor's Home where a number of our students were honored for their incredible volunteer work around the fire. We had amazing and troubling and disturbing, because they're heartbreaking examples. One of our nursing students, Brandon Cousette, suddenly found himself caring for people whose feet were burned as they had raced from their homes trying to escape the fire. We had one of our physician assistant students, Shannon Watson, who's also a registered nurse. She's a longtime disaster relief volunteer, and she lives in Butte County. Quickly organized fellow classmates to volunteer at a shelter clinic, and particularly to care for frail elderly evacuees. Shannon's classmate, Michael Pang, jumped at the opportunity and said to us, "This is a good reminder of why we want to be healthcare providers. This is about serving our community and meeting its needs." One of our faculty said, "I think that too often leadership is seen as a title, but our students really understand what they needed to do and what they have done. That's true leadership. They stepped up, saw a need, and went out and provided care to people who were in need." So with that spirit in this room, I'm again really happy to welcome you and thank you for being here to lead this very, very complex and integrated work that needs to happen to prepare us all for the devastating and ongoing effects of climate change and human imprint on our ecology. So thank you all for being here, and while you're here, enjoy this building and walk upstairs and look at the classrooms and look at the sim space, and be sure to revel in this wonderful space that we're happy to share with you. So thank you again for being here.